you had to loosen it, you can use some normal saline. You just dampen it with sterile normal saline. All you do is pour it on there if you had to loosen it. If for some reason when you went to pull it back it was stuck, you can loosen it with some normal saline. You'll sometimes see peroxide out there, but you've got chemicals in peroxide. Normal saline is more, it doesn't have anything in it, and you really wouldn't need an order to do that. You would just dampen it with that. And literally you pour it on the gauze.
If it was stuck to like the scab that was forming and you...
That would loosen it.
If it didn't, do you take the scab off with it?
Well, you're not going to rip it off.
Yeah.
If you have a hard time, you go and get somebody, you go and talk to the doctor about
Yeah.
it. Okay. You would use this will help. Now, you have to let it sit for a few minutes. You don't just pour it on there and rip. You have to let it moisten a little bit and then gently pull away. Sometimes you do end up pulling some of the scab, but talk to the doctor if you have trouble with that, okay? So I forgot to mention that. All right, so now I'm going to prep my area because I'm going to actually have to clean for the
Well, I did lose
sutures.
10 pounds.
So I'm going to take one
So
of my
far.
Povidone ones. This is a one single applicator because I don't want to waste 3. I'm not going to need 3. So again, I rip where they're perforated. Go ahead and do this, and I use my little cup as my holder, I guess. I'm going to make my tray so that I like it. How I'm going to use it. Gloves. And my tape. Now, suture removal sets, I'm just going to show you, they come, different manufacturers. You actually check these just like you would anything else that's sterile, looking for a date of expiration on them. A lot of times they have like these numbers and you actually have to go to the box to check them.
That's what we weren't doing it.
Yeah, no, it's not anymore.
No,
They don't expire.
As long as
until
it's
damaged.
as long as it's not
Intact and
damaged.
not wet.
Sometimes you might still see them.
Well, I think they're still on there, so we don't have to use them as a
Yeah,
treatment.
so you can look, this one is an incomplete one. I'll make it complete real fast. Because we've reused them a million times. They should have in there, you should actually have your forceps. You should actually have your scissors, your suture removal scissors. Now you see, you guys have studied your instruments, that little lip, and that's to go under, okay? So they should be in there. You should have this in here. And then there's always a gauze on top, and you can use that a million different ways. So that's one package, and you notice these are all silver. I just want to show you, here's another package. This one's got it in there. Get rid of the sutures.
Those plastic.
What?
On the top?
Yep, these are all plastic, so they're plastic and it would look like this. But you can see they both come in cases where you just peel apart.
Is that one a disposable one?